Hello, and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us. We're going to be speaking with Rakhee Langer this morning, Vice President, Healow Telehealth Solutions at eClinicalWorks. Rakhee, well, why don't you tell us all about yourself, give us a little bit of your background, and then tell us what eClinicalWorks is all about.
Wonderful. Thank you, Neil. Thank you for having me. A little bit of background about eClinicalWorks and, the Healow Telehealth Solutions. eClinicalWorks, we've been around since 1999. We are in the healthcare IT space, predominantly in the doctor's offices, working through the electronic medical records and all the other products and solutions that support that, including population health and the patient engagement products, which is where the Telehealth Solutions fits right in. Healow is a subsidiary of eClinicalWorks, completely owned by eClinicalWorks, and the focus is primarily on patient engagement. Whether the patient engagement means access to health records, where a patient can view their medical records on a smartphone or on a portal, or something beyond that to see that they're getting reminders and messages about their health conditions from the doctor's offices. In addition to that, we have online scheduling, we have other patient engagement products, and the focus at this point has been the telehealth solution, where a patient can connect with their doctor's offices, with their doctor, to go ahead and actually have a complete virtual visit. So it's a quick overview of the different areas.
How easy is it to set this up and connect with your physician via telehealth? Is this something that requires download? Is it something that requires extensive training in order to be able to use?
Very good question. No, it does not. It's actually a very easy setup. So on the doctor's side, it is, it starts off from there because the doctor is going to be the one initiating all of this. It's fully integrated into what they currently use in eClinicalWorks. So the eClinicalWorks EMR has all of the integrations to make sure that a visit automatically is now broadcast as a televisit. So the patient starts receiving an email. They can start off from a SMS text message. If they're more savvy and they've been using some of the other tools, they can definitely use the portal or the Healow app to actually connect and get started with the televisit.
Well, I was wondering about the efficiency. You know, you talk about folks who may not be as well versed in using telehealth systems as some others. What do you do to, streamline the visit to not make it so that a telehealth visit lasts for an hour trying to get information? How does that work?
That's a really good question. So patients and consumers, they're all at different levels in terms of the technology adoption. So some of them, they know that, if I'm connecting with my doctor, I need to be ready with this, and this. I just want to make sure these are what I'm going to go through. The wonderful thing that we've seen in terms of the adoption, given the situation, is regardless of how savvy the patients are or how much they have used such technologies, they catch on really quickly because the system guides them through. So when the Healow televisit has been broadcast and the patient gets a text message, it tells them that you can start this 15 minutes prior to the visit. So that's so that they don't have to be sitting in this virtual room where the doctor is not yet ready for an hour before the call, right? So they go ahead and start that. It's literally a link. So when you click on that, it opens the browser and it just starts the process. So the first thing would be if the doctor has said that this is a follow-up to what you said you had a rash on your arm. So in which case the patient can actually complete a questionnaire that says, how long has it been there? Do you have any, pain with it, itching, things like that you can actually go through? If it is an anxiety visit or a behavioral health visit, the questions will be completely different. If it is a follow-up for an orthopedic, let's say they just had surgery and they're now doing follow-ups using televisit, that would be a different questionnaire. So depending on what the doctor wanted as the intake, the patient is guided through those questions. They complete that, and the doctor is notified that the patient has arrived. They've completed all of this. They can even complete vitals, which are optional, but they can complete that. And the doctor is notified in the EMR that the patient has arrived. And the doctor can then review all this that the patient has done and connect with just a click of a button, and the two of them are connected and they start seeing each other right on the video screen.
What type of device must a patient have in order to connect? Is it compatible with a simple smartphone? Do you need to have a laptop?
It is supported on smartphones and laptops. So it really is the preference of a patient. So yes, it is supported on iOS devices, Android devices, and they can also connect on a laptop, Mac, really a patient preference. So the notification comes to them via email or SMS in case of the smartphones. And from there on, they'll be able to connect directly. It's supported on both.
You talked about the questionnaire to kind of go through some of the questions that might be asked during a teleconference or a telehealth visit, getting some of those out of the way prior to that visit. A lot of patients have glucose monitors. They have different things that are attached, different devices in their home. Can some of that information be transmitted prior to the visit or on a continuing basis as they connect with their physician?
Absolutely. So one of the other aspects of, I mentioned Healow as a company and a product suite of patient engagement. We have focused on what we call the trackers. That's exactly what we are talking about here. So it could be blood pressure devices. It could be glucose, blood sugar, but it could also be weight and BMI for, let's say, a CHF patient, or if there has been a patient who's just had surgery and they want to monitor how many steps the patient is taking, Fitbit devices or any other activity-based trackers, they are already integrated, and 100% the doctor has visibility to view that prior to the visit. So they can have a much more relevant conversation with the patient because the two of them are looking at the same elements of activity, blood pressure, blood glucose, and all of these other trackers that are there, weight, BMI.
Is there anything, just to be clear, is there anything that has to be downloaded by the patient? This is something that is instant connectivity as long as you're, I guess, signed up or registered?
No, for a televisit, they can get started with really just the clicking on the link that they receive from the text or from the email. So it really does not limit them to start a visit. So that's one of the main reasons if we look at how the growth has, how given the situation and how there has been a need to connect with all of these patients who are in need of, care at this time. The easiest thing for the doctors to have done is actually to go ahead and make sure that their workflow in the doctor's office supports this. So they just turn on and say, this visit is a televisit, and the system automatically takes that from there and lets the patient know that there is a text message. It automatically goes as a text message. If there is an email, it goes as an email, and they can start off right from that message to say, I'm ready for my televisit.
Let's put it into perspective for our listeners and talk about the rise in telehealth just from your perspective and what you've seen with eClinicalWorks based on just the COVID-19 pandemic.
So the COVID-19 pandemic brought with it, so many challenges for people to be able to get to the doctor's offices and get to be seen by the doctor. And one of the main things that technology, that is telehealth, brought was that bridge and just made sure that it was closed rapidly. This made a tremendous difference. Having a workflow that supports it, having the doctor's office have that comfort to know that this can automatically work with what they currently have, mainly because they need to be able to access their patient's previous records, look at the relevance of everything around in regards to the patient, and to be able to support that. The complete integration made a big difference. And, we've seen, the stats that we've seen over 1.5 million minutes a day. It's gone up from 100,000 minutes. So televisits has been there. Wow. We used to see a lot of, areas such as behavioral health and some urgent care visits that are being used. But once this situation of COVID, the pandemic came in, the growth has been very rapid. Like I said, it's about 1.5 million minutes a day. And it has helped because the ease of use on the patient side and the provider side makes a big difference. And the two connected, and they're able to still care for them just like they would when the patient came to the office. So that's made a huge difference in making sure that the patients can receive the care and the providers can still offer all of this. The changes that were brought in by CMS definitely helped. So the providers, the doctor's offices could provide the care and still send out claims and go through that process efficiently.
I know that 10 minutes is not a lot of time to cover such a vast topic. Maybe we can speak again in some future interviews and talk about the progress of telehealth even after this pandemic runs its course.
Absolutely. Sounds good. But thank you so much for giving me an opportunity as well here. Thank you.
And more information can be found about eClinicalWorks at www.eClinicalWorks.com. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.